The patient was brought here because Bellevue has some of the best containment facilities in the United States. You may remember during Ebola a few years back, one of the first cases was brought here. In general, the medical community says that while monkeypox is not new, we do know a good deal about it. There are some important things we still need to know.
COVID-19 is just one of the viruses, one of the diseases that WHO is looking at. Monkeypox, of course, is another.
And now the World Health Organization says we need to get a better understanding of monkeypox as quickly as possible, with the virus for the first time seeming to spread more outside the African continent.
We cannot afford to take our eye off the ball on. And so there are many people that are working on this.
Here's what we do know. Monkeypox cases, which over time produce troubling-looking rashes or sores, tend to come out of Western and Central Africa and usually follow contact with an infected animal, mostly rodents. It can be fatal up to 10% of the time, but other data suggests it might not be quite that bad. And the smallpox vaccine can be used to help control outbreaks. After a 7 to 14-day incubation period, symptoms begin to show with a fever, headache, and weakness, followed by the swelling of lymph nodes in the neck, groin, and armpit areas. Then the rash comes. But here's why epidemiologists do not expect this to reach the levels of infection that we saw with COVID. Monkeypox spreads human to human most directly through body fluids, sores, or shared articles of clothing or bedding. Airborne transmission through respiratory particles is possible, but usually only in close settings like a home. The World Health Organization does stress we need to learn more about this disease.
We really need to better understand the extent of monkeypox in endemic countries, like in DRC and in Nigeria, Central African Republic, and others, to really understand how much is circulating and the risk that it poses for people who are living there, as well as the risk of exportation.
That other domestic case was confirmed in Massachusetts a few days ago. There are other small confirmed clusters both in Canada and Europe. Live from Bellevue Hospital, Henry Rossoff, Pix 11 News.